Welcome to Health AI Insights, where we dive into the transformative world of artificial intelligence in healthcare. I'm Lily Body, your guide through this fascinating journey at the intersection of technology and medicine. Imagine a future where AI predicts illness before they strike, where your medical records are instantly accessible and securely stored, and where personalized treatment plans are crafted just for you. That future is happening now, and right here at the University of Texas at Austin, we are on the forefront of this revolution. Each week, we'll bring you in-depth interviews with leading experts, groundbreaking research, and real-world applications of AI in healthcare. Whether you're a tech enthusiast, a healthcare professional, or just curious about the future of medicine, this podcast is your go-to source for all things AI in health. So get ready to be inspired, informed, and amazed. This is Health AI Insights, where the future of healthcare is unfolding today. I'm here with Dr. Daniel Stromberg. Dr. Stromberg, would you introduce yourself and share a little bit about your background in healthcare and AI?
Sure. So again, my name is Daniel Stromberg. I'm Director of Cardiac Critical Care at Dell Children's Hospital and uh, Professor of Pediatrics and Surgery and Perioperative Care at Dell Medical School. My interest in AI and healthcare comes from my work in the pediatric cardiac ICU. And I can tell you that we gather a lot of physiologic data on our patients all the time, but we really only make use of the snapshot of that information that we see when we're rounding at the bedside, which means that we're missing a lot of other information, or we're missing the opportunity to analyze a lot of other information that might be helpful in the care of these patients and might allow us to have a sense of when things are going off the tracks before we see something that happens clinically. So we're really trying to figure out how we can have the computers and these algorithms working in the background to alert us to problems before we might even see it ourselves in the physiologic monitoring data.
Yes. Okay, so kind of along those lines, can you tell us about any exciting healthcare AI projects you're currently working on?
Well, we have a number of them planned, but I think the interesting thing about what can be done in our unit in particular is that we're recording all this information in a platform called SickBay. And so we have all the physiologic monitoring and waveform data from all the patients all the time being stored. And what we can do then is look at patients who come to our unit, and we know that at the time of admission, they don't necessarily have the problem that we're looking at. And then at some point in their ICU course, they have this issue, and we can ask the question, okay, does the monitoring information look different between point A and point B? And if it does, can we go back into the information that's been stored in the middle and see if we can determine an electronic signature for the early development of that outcome? And it turns out that there are some situations where we might be able to do that. So for example, the first project that we've looked at has to do with the development of clots or thromboses around central venous catheters. So we put a lot of central lines, which are relatively large, in very small blood vessels in children. And we know that some percentage of those patients will develop a clot around that catheter, and those clots can have really important or deleterious consequences for those patients, because it sort of blocks off venous return for some period of time until collateral circulation develops, or it ruins access to that vessel that we might need in the future. So we looked at central venous pressure waveforms in those central lines from the time that someone comes back from the operating room to the point at which we knew that they developed a clot. And we noticed that the central venous pressure waveforms were really different looking from the time of no problem to the time of clinically recognized problem. And so we said, okay, to our engineering colleagues over at UT, we said, can you, look into this data in between and see if you can start to discern a change that one could recognize, well before the clot develops. And it turns out that there is an electronic signature for clot development that you can see in about the last 48 to 72 hours is when you really start to get a strong signal of that change. And so it opens up the possibility of developing a very specific monitor for the development of clots around these central venous catheters. And so if we could get an inkling of developing risk for that outcome 48 hours ahead of time, we could do things like increase anticoagulation or remove the line or, do something to prevent that outcome. So this is a model for how we want to approach a number of different problems that we see in our ICU.
What challenges do you see in applying this kind of technology, and what clinical problems do you think that could arise from this?
So one of the big challenges that we face is really just getting, um, clean data that um, we can filter out, the movement artifacts of the patients and those sort of things. So there's a lot of engineering work that has gone into what I'd call scrubbing the data to make sure that what we're seeing is not artifactual. And thankfully, we have excellent and very expert colleagues who are doing that work on the engineering side. I mean, the other big challenge is really, maintaining privacy, but allowing our engineering colleagues access to some of these data. So, they have to oftentimes export this information out of our clinical platform so that they can apply their tools to it. And that turns out to be a little bit of an administrative lift to get that accomplished for them. So we're in the process of trying to work with both UT and Ascension to develop credentialing for the engineering component that can make that a more seamless process.
Yes. So then that kind of brings in the ethical concerns that arise with patient data and privacy. So, what are y'all going to do to combat that?
So first off, all the information that is being worked on for these projects is de-identified. So there's really no way for, other than for, the primary investigator, like myself, to be able to go back and, connect who goes with what information. So de-identification is very important in, keeping the information anonymous. Um, but I think we do a good job with that in a way that is not threatening to the patients. The other hurdles that will come once these algorithms are developed have to do with, the regulatory process. And so each one of these, monitors of a specific outcome will need to get FDA approval. So there's a little bit of a hurdle there that we need to get to. But I think we can overcome those. Then the other question that we'll really need to ask is, how accurate would these monitors be? And are they accurate enough so that they become really clinically dependable and useful? So, we feel that we have an algorithm that in a smaller cohort of patients works well to demonstrate this risk of thrombosis, for example. What we need to do now is apply that algorithm to a much larger de-identified data set at, say, other institutions to see if there's generalizability of our findings and our algorithm. And if we find, fortunately, the data sets for that are available. But if we find that it really is generalizable, then the next thing that we need to do is sort of a clinical trial to look at, how effective this is in a clinical setting, and what are the costs of implementation versus the benefits of implementation. And one of the big knocks on a lot of the AI work in healthcare is that it's very theoretical. It makes a lot of sense, but it doesn't apply well at the bedside. I think that's just a matter of perseverance. I think we'll find that as we get better at making the algorithms and refining the algorithms and testing the algorithms, that these things will eventually become an accepted part of practice, because they offer such great benefits, again, to the practitioner. I mean, if you think about our model for taking care of patients in the ICU, we round, in the morning, and again, we see a snapshot of what's happening with a patient. We depend upon the nurses to be our eyes and ears at the bedside when we leave to go talk about the next patient. And, the nurses these days, are also busy with, many demands on their time. So the computer, doesn't get sick. It doesn't miss a day of work. It, is, vigilant all the time. And I think if we can get to a point where we're really taking advantage of the things that computers can do that we can't, we'll be in a much better situation in the ICU.
Yes. So, what advice do you have to offer young clinicians who are interested in integrating artificial intelligence or other technologies into their practice?
I would say that now is a great time to get into this field. It's a great time to learn about what's happening and to think creatively about the problems that you see around you, and which one of those might be amenable to some sort of machine learning or predictive analytics solution. There's so many, uh, and just in my narrow area, so many outcomes that we can study that will probably be impacted by the ability to harness this information. And, I think, if people are interested, come to the PEDS Cardio AI conference, come talk to people who are working in the field. And I would also suggest that people consider educating themselves in data science, to the extent that that's possible, because the tools that are being applied are, things that the average, medical school curriculum is not gonna provide you. So you may have to go outside of that to really steep yourself in the, details of the field.
Yes. Well, thank you so much for giving me some of your time and letting me interview you. Do you have any last words of advice?
Just keep an open mind about AI, and if it really interests you, again, this is a great time to learn about it and to think creatively about solutions for real clinical problems. I think ultimately the patients will benefit greatly.
Yes. Well, thank you so much. I appreciate it.
Yeah, of course.
Thanks for tuning in to Health AI Insights. We hope you found today's episode enlightening. Stay connected with us for more deep dives into the world of AI in healthcare. As Dr. Stromberg mentioned, the PEDS Cardio AI Conference will be held September 5th through 7th. It's open to anyone interested in medicine or artificial intelligence. I'll put the link to register below. Also, make sure to check out the UT Austin AI Health Lab, which also I will link below. Don't forget to subscribe, rate, and review us on your favorite podcast platform. Until next time, keep exploring the future of health and technology.